Madam, we are very happy that you have come here, and because we always want to speak to people and find out how they have really, how the institute has contributed to their growth and as how they have contributed to the institute's growth. But person is not just in this institute. We are people who have roots somewhere and we have grown somewhere, and all that has brought with our own understanding we have come to this institute. So if you can say something about yourself and then leading to this institute's growth, we'll be very thankful, madam.
Thank you, Dr. Kamakshi and Dr. MEHTA. It's wonderful coming back to KEM to give opinion on such a subject. Now, I remember that I was one of the eldest child in a family of 7 children in a very middle class family, and my father was just an ordinary office goer, secretary to an all India organization. But this family, my current looking back on is that it has taught the basis of my life values. My mother, though just a housewife, and my father, both of them gave prime importance to inculcation of values. And we were 3 daughters, 4 sons. So my father said that I come as a teacher's son. So I have nothing much to contribute from financial point of view. But one thing that I can offer you is education. So the education of whatever kind you want, whatever you want to study, will be available, and then that will make you stand on your feet. And for that I have a lot of gratitude to my parents and the family. Then I went to a school, St. Xavier's, which was also a Christian-based school, and they gave us, first it was compulsory for us to go into the church, and then later on they separated all those non-Christians and put us on into some moral science classes. But I enjoyed by the days I spent in the church also, because it has laid a deep foundation of Christianity aspect, and my parents were very much of the Hinduism thing, with a lot of rituals in their life. So that my decision to work harder was only inculcated after this 4th standard. Till then I was a happy-go-lucky person with life as it came. Then for the first time I suddenly came out first in the class, and I was reading the storybook when the results were being announced, so that I didn't realize that I was being called to accept the certificate as a first rank holder and all the many proficiency cards that I had got. And I saw the thunderous applause that I got, and that sort of motivated me that maybe I should do better in life by hooking on to academics. So from that time onwards, life has been a journey of wanting to stand first or second in the class, and that continued. And I wanted to be a doctor. That was also there before I finished my school, and there was no doctors in the family, but somehow healing motivated me that I should be in a healing profession. The medical to me at that time was equated with healing and not what it stands for today. So I went to a Wilson College after my St. Xavier's school, and then I just managed to get enough, because at that time my grandfather, who was a great model, died, and I was very upset with his death. So I wasn't able to study for my inter-science because I was left at home to look after all the other children in the family, and therefore it interfered with my studies. I didn't do as well in the inter-science, but anyway it gave me enough marks to come into a medical college, and my cutoff point was at the G.S.MEDICAL college. All of us aim at wanting to go into GS, so I was at the last brink where I opted out for TNMC, and that was a good institute, because I think that it was a very friendly institute, and I was there for all my undergraduate days, postgraduate days, and also as a staff member till I became a leader. And it had its own friendly environment and very rooted there. And then subsequently I got deputed into the World Bank India Population Project 5. And I went off into the public health department, which gave me a good leverage and understanding of the public health system. I chose PSM voluntarily, because though I was first in the class and I was a TCF Rally's gold winner at the 3rd MBBS, and I was also the Rotary Prize winner for the best student of the college. Something in me always wanted to go and work in the slum for the poorer sections, because healing was at the thing. And then I chose PSM. The dean also at that time told me that I was making a mistake, because those days there was not this inter-collegiate competition and MUHS and all, so that I could have got the profession of choice I wanted, and I said I want PSM. So this is a dead subject. I said it is not a dead subject. It has not yet been born. It has to come into existence, and it has ways to go, and ultimately all medicine will have to become preventive in its approach, because problems in ill health are going to increase to such an extent that it will get recognized at some stage in life. And I want to choose PSM. And anyway, I then therefore went into the PSM department, also because I was a great admirer of Dr. Saroj Jha, who was at that time the associate professor, but later on she went to become the head. I liked her personality, I liked the carriage, I liked her confidence and how she was able to deal with the whole thing. So it didn't matter to her that she was just a PSM person. So she was my model teacher, and then I followed her into this profession, and I have no regrets, because though I may not have got the necessary recognition or made money in life, somehow it has ultimately brought me to the prevention of all conditions, prevention of suffering in life as such. Because it, after 1983, when I was still at GSMC, I lost my husband and I got into a mental disturbance in life as to what determines life and death. And then I was drawn into a lot of mystical experiences that happened on its own, and that was the advent of grace in my life, and that sort of rooted me more firmly into spirituality. And I found that by 1983, 6 months after I got the awakening of the spiritual thing, I got this thing of the oneness in the whole world, you know, the oneness bhava, atma darshan, which is said. And therefore that became the stepping stone for my whole transformation of myself to reach the goal of human life, which is supposed to be moksha, to be always in that state of bliss and peace, irrespective of what your life conditions are. And when I got the self-realization, I wanted to leave the body and not come back, because I was out of the body and in bliss, but I had to come back in. And that I had some role to play myself, and therefore till that role, prarabdha karma, is over, I cannot be out of body. Hence, I came back into the medical profession again, but now a changed person. All that academic zeal of competitiveness was gone. I was no more interested only in personal aggrandizement, and I had to play the role of a woman in society properly, wife and the children's mother. And the second thing was a profession, and in profession I had to take the right line to have the right values. So that is how when I came into KEM from TNMC, I was already in the transformative stage. So my statement at the first meeting of my staff was that now I have realized I want nothing in life. From the academic climbing angle, I have reached the head of the department's position, and that to a G.S.MEDICAL college. That is enough. So I now give full freedom to all of you, to your own aspirations. I will not come in your way, but we will all have to abide by the goals of the institute and the goals set by the department. So within the ambit of permitted conditions within the department and the institute, you can all have your choices of making your things, your dreams come true. But institute will come first, the department will come first, and then only your personal goals. So when I came here, I first was studying the strength, and that is how my further story of development, what this institute contributed and stands on. But
Madam, you really took initiative in inculcating spirituality for even staff, even students. You took took a lot of interest in having yoga classes in the department. That was the first time it happened that you started that, and you saw to that that people take part into it. So
yeah. So the thing is that we have heard a lot about GS because we know that everybody wants to come to GS and it's one of the highest thing. So when I came into GS, I was wanting to first certain principles I have that you have to start from where the institute is. So you have to build up what other people have contributed, not try to pull down anything. So my first decision was that I would build on to whatever was achieved and then see if there were the strengths of the thing, note them, and see what were the weaknesses in the department and only try my best to rectify those things. So that is why I was convinced that we had a very good faculty. Everybody good in themselves, and a large faculty, much larger than what we had in TNMC or in LTM, it's the same G.S.MEDICAL college. So it was a good faculty and it had its own strength. The department had achieved a lot. It had got some recognition at the national and international level with Dr. Pai having established his own family name in the family planning arena. In fact, when I came from United States, I had gone for 3 years on deputation to United States. And when I came back, they were ready to offer me Planned Parenthood ke liye big sum. And they said that provided you register under Dr. Pai for it. And Dr. Pai was in GS at that time. I said, no, I can't register under him, I'm in another institute. But we will see. So I knew that Dr. Pai had achieved his own thing. Dr. Balarao's child-to-child program had also been acclaimed within the Malami Health Center and international. So those two things were definitely going to be supported in this. And then I noted that within the department there was a lot of divisiveness because somebody was for Malami Health Center, somebody was for only the department. So there was no cohesiveness, and that became the weak point because there were fundamental groups that were not contributing to the harmony of the department. So my first decision was to break down these barriers and try to bring in harmony within the department. I hope you don't mind my saying that here, but that was one of the identified things that I wanted to do in this institute, and that was what the approach. So I made everybody give me in confidence what they were in the department, what work they were doing, what dreams of theirs had been materialized, or what were they thinking as barriers or badas. So I gave confidentiality to everybody, and then after they gave me in writing, I took everybody for a special interview, and that was why I made my decisions that when I become the head, I will not have any project for myself, but it will be supervision of all the activities. So teaching, services and research would become a supervisory thing for me with no vested interest or no vested thing that I want this, but give the necessary freedom but inculcate the spirit of love and trust in the department. And that is how in my earlier days itself I started to bring in yoga in the undergraduate teaching. So clinical clerkship, when we introduced yoga, and I was told that I should not spend much time in non-accepted subjects. Now at that time, the spiritual dimension was there in health. People's concept of what time I was wasting in yoga was always standing out. So therefore Dr. Navalkar from PSA, from physiology, yeah. He was also interested, so I let him take the practical part of it on every day. So I came in for theory and a little bit of practicals. And then the yoga got into the thing. We wrote some papers together, we published them at the Lonavala Institute where we had gone for presenting. And then we wanted to see whether we could do it with the hypertension OPD, where Dr. Navalkar went in and did it. But then a time came where I was asked by the head of the institute that I was spending too much time, and other people, staff members were also getting interested, so I should do it after working hours. I said, as long as I confine my teaching within the 3 hours of clerkship and I will not include staff in this institute into yoga thing, it should have no objection. So I continued with that yoga, and then I also got into Satyasai Institute of this thing which is there at Maroon, Dharmakshetra, they asked us that they wanted to introduce human values in medical education. With the dean's permission, we had a half-day workshop or a conference for all the staff members of GS, and subsequently I arranged a 2-day workshop at the Dharmakshetra for all other medical colleges, both private and corporation and government, and to bring in human values. And that is how the teaching of ethics, human values into medical education as a stepping stone. That led me to the holistic health concept. I managed to increase a few of the lecture series in mental health, which was very less before. And those lectures I myself took. And then we had this subject introduced into the postgraduate session also. And sometimes, somehow or the other in this, you find that there is a force that helps you. In Nair itself, the first time I took a seminar on the spiritual dimension, I was told by the head then that it is not in the curriculum. But I said, no, all of you are taking curriculum subjects, let me take this. And then what happened was that that particular examination, I was not the examiner, some outside examiner had set in a whole question of spiritual dimension. With the result that all the students came to me and told me that, good madam, you have taken, then we wouldn't know what to write. The whole this thing, and we would have got a C, so it would have been a stepping stone down for failure. So I said, see, this is the way it helps. So anyway, for post-graduation, and then we also arranged we wanted to make this a little bit more stable, and I tried to see whether the spiritual dimension in health and holistic health concept could take over. I've done my bit, but it has to take off, it has to continue. It will take its time, but in the end, Dr. Abelkar has given some 15 lakhs to this, but he did not specify it to, and even if specification doesn't mean anything, it is not departmental, because after all, this is a subject where only few will be interested, and whoever takes it up, the institute should do something. He wanted a body-mind medicine as a subject to be introduced, and I find that it has not yet taken off. Shubhangi Parkar, the psychiatric person, was also interested with us, and we incorporated mental health in the Malami Health Center. So they brought in for the drug addicts some project, and so normal mental health deviated people plus the drug addicts were being treated over there.
Still continues, madam.
It continues, and she did her PhD in mental this thing she took it. So I thought that was trying to integrate mental health in this, and then now I understand she has gone a little further. She has taken Goenka's courses and she is spiritually inclined. So if I could have played some role in the conversion of one, because psychiatrists are very important people. Yes. I myself have been very influenced by a book called The Psychiatrist and the God Man. Psychiatrist Samuel Sandweiss, he is in San Diego. He has written a beautiful book on psycho-spiritual therapy needed to be included in medical education. So that paved the way for that, and the rest will be taken care of by the higher this thing. But wherever I went, after I went from GS, I went to Sobaya. There also I started, and they told me to take this yoga concept into the immune deficiency. They had got a big grant for people with HIV/AIDS, and I decided to supervise a particular person from yoga who was appointed there, and it became an indirect activity of the department. But within 6 months, I was asked that they don't see any results. So what results, I said, you expect to see, because these are all HIV infected people with the sword hanging at the neck, and how do you expect to see results? They will not become HIV negative, and incorporation of yoga and nutrition alone will not shorten their life. We have to see in time, and for them to accept yoga at a time when they are very upset about the condition, it's very difficult. Because these things have to be done at an earlier stage, not when the person has got AIDS and all that. But yet there have been a few who have succeeded. So then they removed the tutor. They said, no, this dimension will not work with us. So they cut out the grant and it was off. At G.S.MEDICAL College, I went there, and there also I started with my own thing like that. And but then there are to take continue the thing, I don't think that it was possible, and I don't know the status here also.
Yes, madam, we have on and off actually yoga trainings going on. Once in 1 year, maybe 3-4 times at the this thing of maybe 2 weeks, 3 weeks, 3-4 times. It is continuing. Some
Those
people are
Ramakrishna Mission had
interested.
contacted me again to say that things were coming down at GS, whether I could intervene again, because the rural center we had tried. I was there till memorandum of understanding was signed, and that it was not working out so well. But I said now I'm out of the institute and I have no business trying to go and do something over there.
Actually, we still continue with Sakwar, madam. We still continue with Sakwar.
The way you want it, you will have to make your own effort. I cannot do that. Nor here at Terra like that.
Actually, MCI is one which really modifies the whole thing because they wanted something very nearby, so we have adopted some more. But we have continued with Sakwar because it gives a very different kind of experience to our students. I wanted to ask you about your contribution towards very big contribution that is first in the country maybe. That is your this thing with UNICEF and Adolescent Health Initiative which you took forward.
So that was another issue that was always that adolescent health was very important, and it was a neglected child, neither belonging to pediatrics nor to this. Adolescent health issues are always very different, and women's empowerment has to start with the girl child's acceptance and the girls' empowerment to make decisions in her life, and then the woman will get empowered only through that. So therefore, when UNICEF offered this particular source of the Adolescent Girls Project, I was ready to take it up, and we tried to implement it, and UNICEF did a big thing. And by the time, because I was also a member of the Public Health Department, and this institute already had a good rapport because the Executive Health Officer, Dr. Vinodini Desai, was a staff member of the PSF department here. So we got a good support, and that is how this became the center for the Adolescent Girls Initiative. And I had very committed staff members like Kamakshi and Shikala and all that who were interested in this, and more than that Shobha Kavli. So the project really went ahead, and it was a successful implementation, and there have been many papers on that, and some modules also we prepared, and that is good. And therefore, as a culmination to that, I wanted to start an adolescent health clinic, which I managed to get it inaugurated, but I hear that has closed. Well, the other thing was the general practice OPD, because I always feel that the PSM department is concerned with basic medical care, and we have to have clinical acumen good enough to treat patients, and then referrals can take place. So therefore Dr. Pai, who was the dean then, was also interested in this, so therefore she asked me to start a general practice OPD. Perhaps it is the first one in Bombay. In Ahmedabad it was running like that, some of it in the Mahatma Gandhi Institute at where is that? At Varda. But it has not been accepted everywhere else. So here we started the general practice OPD. First by invading into the medical OPD. The level, Dr. Tilbe was very cooperative, and we brought up that where a lot of rules and regulations had to be modified, and it had to be accepted by the department, and in a way it has been. It is still going on, right? The general practice.
Yes, ma'am.
Very much. And it is a good thing because it brought down the load into the patient load specialists.
Right.
So much crowd it was. And I think that it was a good thing to continue to be a doctor and then go into the public health administrative aspects. And one can do more wonders if you are clinically oriented. Recognition also becomes easy, and I myself was trying because I was in US and I was working in Department of Obstetrics and Gynec for 3 years, but I had the family practice in mind. So I wanted to bring in the concept of the family practice into medical thing over here, and I had the good fortune of being nominated as a board of study member when I was a reader. Well, Dr. Chak thought that I had a grip over the whole subject and I was interested in that way. So she gave my name to be a member of the board of studies. And there, first it was when I was a student, it was just a paper in the thing with a third MBBS, 50 marks paper. And after we went there, the MCI was also thinking about it, it became a full paper and third MBBS. And then it later on got shifted down into the middle between second and third. I couldn't, avoid that because it was general MCI thing. But this within this subject, we need to develop expertise. It's not a general PSM. You need people who will become MCH consultants, preventive medicine, cardiology preventive consultants, neurology preventive consultants. That will take a long time to develop, and people have to become. Now people like her have been, you have got into the women's empowerment and women's issues and child abuse. See, the whole thing is becoming big in itself. So we need people to develop interest in each of these things. So therefore, it was unfortunate that people were thinking that the child to child was so popular. I tried to make it youth to youth because I tried to bring in population education into rural slums, and then sex, adolescent problems into this institute. But that OPD, if it had not got shut down, I would have been happy, because it required cohesion between PSM, gynecologists, then the pathology, laboratory thing, psychiatrist, because adolescent problems are beginning stages of personality issues and sex related, and the drive is all hormonal. For them to understand the deeper aspects of love and cooperation and family as a unit, it requires an in-depth understanding of what love is at the deepest level, and therefore I thought that adolescents will be benefited. That has not happened. In Delhi alone, I think All India Institute has an adolescent clinic and some other clinics, but that didn't work out, I think. So it is the next person has to be convinced of it, and it didn't go into the right hands for people to be convinced. Because immediate staff member next to me would have seen that it worked out. So you always have to cash in on what is established and then help to develop it, but that attitude was there. And the issues also become different, so that way it will work. So that is it.
And we want to ask.
How many years were you here in K? When did you shift?
I was, in 1990 I was promoted, but I was with the public health department. It was a contract that each one of us be there for 5 years. So one reader was taken from 3 medical colleges. I came into public health through TNMC. Then in between there was a promotion. So there it was an agreement that I come only for teaching back, but I continued to work with them as officer on special duty. I was in charge of the western suburbs. And hence, though I came here in 1990, 90 to 92, till Balarao retired, I was a visiting professor here only for teaching and not really taking part in other administrative activities. In 92, when Dr. Balarao retired, I had the choice of wanting to continue or be here. I opted out of the public health department because I felt that I had done what I could do for the western suburbs, but I didn't want to make a career in public health, very different from my value system, so I came back into academics. And that is why 96 I am here, but 92 I became the head of the department, 92 to 2002 when I retired. So 10 years, 12 years actually in KEM, and 2002 when I retired from there, I went to Sumaya and then later on to Terna and retired from there in 2009.
So you said in between you did gynecology and obstetrics.
Yeah, that was, I had just joined, I was going to join G.S.MEDICAL College, beginning of my lecturer post. After the thing, I had been selected for TNMC, but Dr. Panse, who was the dean, he wanted me there. So he played a role in getting me shifted from Nair into Sayan. I had no objection because that time I was staying in Chembur, suburbs, that side. So I joined G.S.MEDICAL College, and within 6 months my husband decided to go to US, and then my in-law said I had to go with him, and therefore I requested them. They said that you take for 2 years, 1 more year you work, and then we will keep your post here for you. But I couldn't do that, family pressures. So I left G.S.MEDICAL College within 7 months of my joining it, and was in US at St. Luke's Hospital. Initially, because I did not have ECFMG, I had to work as an assistant. Then I passed my ECFMG and then was taken as a fellow in OB-GYN. So though I did not take up a residency, because I was good at the surgery thing, they took me as assistant in private hospitals over there, where I would be paid like the American this thing, the per hour dollar issue, and I continued as a fellow in obstetrics and gynec over there. When I came back, I was having my daughter also, so I couldn't do residency here, so I had to be contented in joining back PSM at Nayar Hospital, and so my career became in PSM. I could not get into
What do you mean by joining back in PSM?
Yeah, I left SAN, I resigned.
As a PSM?
PSM only there, in SAN PSM. I was taken for Nayar, but Panse wanted me there, so Saroja didn't mind giving me there, and I didn't mind going there, so I went there. And then, therefore, it was a resignation from BMC, and therefore, it took me 2 more interviews. Though I was selected at the first time only, I did the mistake of going, and Dr. Mrs. Kekre had me in the head there. So she came and hugged me, and I went and hugged her. So that became negative in the interviewers board. They are not supposed to show familiarity. We didn't know. I had come back from States. So Mrs. Kekre spontaneously got up and she extended her hand, and we went in. That social thing went against me, and then I had to appear for another interview to get selected. So 6 months went waste. I was there as a lecturer, but I was not regular, taken as so after the second time I interviewed, I took care not to smile at people. And then
You mentioned also about deputation, so what was that?
No, I didn't get deputation from Topiwala National Medical College into public health
Public health department.
That was much later.
So
where
did you have to?
I had to do into public health. I was given the western suburbs. So I had my office at Bardawadi in Andheri, and the whole thing from Bandra up to Dahisar was my area of supervising all the health posts for successful implementation of the family planning program. IPB5 had many other objectives. So I was for the western suburbs, and I joined there, and I was at a loss because the public health department is very different. And then it took me 2 years, 2.5, 3 years only I was there. But to bring the western suburbs into the top category of ratios, rates and all the mortality rate, infant mortality rate, we were on at that. Because mother and child and family planning was the main thrust there. And I enjoyed my stay there also.
So, according to you, what are the plus points of Government of India's scheme of mother and child welfare, and what are the points which they are not able to implement?
They did give a lot of importance to the reproductive health. So it was a good initiative, and it did run well. And I compliment the Government of India for implementing that program in quite earnestness. And I think that today there have been a lot of improvement in maternal mortality bringing down, infant mortality has been brought down, and family planning has been accepted, but it has not gone to the same thing in all sections of our, and therefore the population growth rate has come down definitely, but it didn't reach the state where we could. But anyway, in any public health and in preventive medicine, action at community level never becomes visible to sort of get the needed applause immediately, but it has done a good job. Because even in the NGOs, I see that they are all with NGOs.
So I feel that there is certain intermix of hygiene, sanitation, prevention of diseases, maintaining health, and taking care in terms of age-related.
See, what has happened is that the concept of the subject of preventive medicine has undergone a sea change from the time it began. When it began, it was related with hygiene, and therefore it got associated with just physical hygiene, drinking water and toilets. So people thought that was the ambit of this. But as the subject of PSF developed, it became evident that microbes were playing an important role in the causation of diseases. So we had to be aware of controlling the bacteria. Then the antibiotics came in. So prevention of diseases, that technological things started advancing. But even today, if nutrition of people is improved, the water sanitation is improved, so also the waste disposal and all is taken care of, there will be a lot of decrease in the reduction of the infectious diseases. And the rodent control, the insect control, it takes time, and therefore the malaria, all national control programs that got implemented had their own ups and downs, and we have not been able to, except eradicating smallpox and polio now, and measles to quite an extent, and the guinea worm disease that has got eradicated. It is a very slow process because nobody is giving that needed importance to the hygiene. It has to come from within. The whole matter has to be taken care of. Money spending in the health sector is very less, and unless that improves, subject of PSM, then the PSM went from PSM into community medicine with community aspect, that you have to take care of the whole community and develop that kind of mentality. So you have to be a field-based doctor, integrating with so many, with other services, water, food, distribution, and the general environmental cleanliness, being very sensitive to environmental sensitivity, even issues like dowry issues and issues like the rape issues, child abuse issues have to be taken care of to improve the general health of community. So then it graduated to being called a community medicine department. And certain political things are happening there at that level, but today therefore it is community.
So, is it necessary? I think, as I see, that epidemiology is a strong forte of PSM. So, how much various?
No, the epidemiological studies are not yet developed to the extent it should be. The thing is that you need more avenues of employment in that, and then to pursue the study of epidemiology. Just that it is there more in public and outside countries, not the same thing. Indian situation is very different. So we will have to have more institutes concerned with public health, academic collaboration with the medical colleges, and epidemiology studies will have got to improve. And then only it will be. But of course, a lot of things have been done with tuberculosis, leprosy. Many achievements have been there in that thing, but India's main thing has been the population, our disability to spend the right amount in the health sector. And a lot of privatization has occurred, and we have become, in the technology field, we are spending more money in that. So we are not able to do justice to the general public health.
So this Prime Minister's entire so where do you think all departments of PS, preventive and social medicine will contribute to this?
Yeah, with all of what all the PSM people can do and are doing, I feel that they need to be injected with a greater vigor and commitment to their own field, because somewhere a complacency has come in, and the right approaches are yet lacking. But the Department of PSM can do a lot of things now, because the Prime Minister's latest thing spells out a lot of recognition of very many things that can be achieved by not only doctors, but by having the paramedical staff and making them corporate responsible over these things also, and having a lot of other courses, even for first aid or road accidents or laboratory technicians. All those paramedical courses also need to be strengthened, so that at the grassroots level of primary health care and secondary level of health care, they are strengthened to manage health conditions in the human thing. And PSM departments should be clinical oriented, yes, but they also should be more field based. And there is no use of PSM people being chairbound executives, because working in the field is very different from sitting in the chair and then ordering policies on saying that this is right and that is wrong. So personal aggrandizement doesn't occur and we never get recognized, but it has to be more self-satisfaction that you have to achieve by field work. So I think until the PSM staff really also chooses to do this, they have tremendous scope. And I also think that preventive medicine, going to the primordial approach is very important, and for them to become yogis is very important, because the whole expansion of vision, expansion in consciousness occurs as you become a deeper person. And therefore I feel that somehow yoga and the yogic institutes that are there are playing a better role for health than the medical college. Medical college's preventive medicine is still illness oriented, but we have to go to the spectrum. One end will be illness, neutral point is not the health, and the well-being you have to go, and for that the wellness concept has to develop. So inner growth, inner development, self-actualization and high-level wellness will be the forte of people who go into the inner journey. You don't have to be belonging to the preventive and social medicine department for that. Every human being has to take this illness wellness continuum in life. Everybody is now specializing in illness treatment. Nobody is going towards wellness. And old age, illness and death have been there for a long time, and certain things have improved, but we also need, all of us as a medical specialty, have go into the wellness concept. So I think that that will be the thing. So though I might have had the worst condition of a cardiac thing, I am in a wellness frame. That had to happen, it has happened. Various reasons for it, they play a role. But you have to feel well and you have to be ready to contribute towards wellness. So that consciousness expansion will make people include a larger section within the ambit of welfare projects, and values will have to improve, and it is becoming so competitive, and corruption will go from the society when all human beings go towards the self-actualization and high-level wellness feeling. Illness we are not able to, we are able to prevent to some extent, but we can never go to a stage where illness is going to be eradicated. So knowing that, the only escapism is going into, escapism nahi, only the right, it is the humans, I don't know what to call it, absolute duty is, the goal of a human life is only self-realization. That will make you a better human being in whatever vocation you work. And if we want to eliminate the corruption and the materialistic thing that is happening more and more in all societies, the only way is to start teaching the wellness concept right from the school, college, and then it should find a greater avenue in the thing. Though there is a lot of subjects, and the in-depth subject thing has missing so much, but yet PSM people especially, I am sorry that they don't make their breakthrough. They are not going to be the real PSM staff. What they have to achieve cannot be done. So everybody is feeling inferior complex. I don't feel inferior at all for having chosen this speciality. That is all. You cannot achieve everything in one lifetime, but other people will take over, and at some time, if India is today looked upon for a spiritual thing, then even in the field of medicine, and I recommend the 7 mystical laws of self-healing, where he clearly states that the future of medical care has to be preventive in its approach. It's not preventive medicine, preventive in its approach, then only we will be a healthier nation. And that is what is needed.
So, taking this thing a little further, see, students, I mean, I'm just not talking about students of our institution. How do we inculcate in them the sense of, what shall I say, that wellness, what you are talking about, starting with keeping their own self and not follow the...
I think more time needs to be given at even the junior level of teaching this human being as a whole, You can't go and teach them Patanjali Yoga Sutras and become mental health experts. But the whole human being and the purpose of life and the goal of life, human life, has to be in the humanities. We have got provision now from the MUHS that the humanities have to be introduced for the first 15 days or something. Has that period been extra exempted? I don't know. But the people who teach should be people who are convinced of this. Now, if I talk of a spiritual experience, I'm sure that people will be hit somewhere at some time, that this is what. So when the wellness is what karke, that has to be done right at the first MBBS level when they have not become illness oriented. And how illness is different from wellness, in short, nobody can become an expert at the total illness. So also nobody can become an expert at the total wellness. But as much as we study the basics of so many conditions and then leave the expertise later, so the in-depth of the wellness should be brought to them. Therefore, I had introduced the visits to medical students into the Santa Cruz Yoga Institute.
That continues, madam.
That continues, but what happens is the zeal with which the department gives importance to that, because I have gone personally to the Yoga Institute and I find that many students escaping from there, and then I have made personal visits to see how many I send from here reach there and what have they learnt from there. So those students who have gone there have become converts right at second MBBS. Some of them come and tell me that they want to join yoga, they have joined this, joined that, but I say don't become fanatics. You are a medical doctor first, and then because some of the students become mental fanatics. And in third MBBS, I found one student at Nagpur where I had gone, Om Sari Krishna, some Krishna, whatever they write, full in the paper. I took pains to call that student separately and told him that sorry, Krishna will not come and give you marks for this paper. Okay, zero, nothing. You have to know where it belongs. Krishna belongs. Don't mistake that anybody is going to get sympathy with you and do that. So you have to see that they don't become fanatics, but they understand the value of a deeper being in yourself. What is the meaning of well-being? What is the difference between a human being? So instead of focusing on doing, you have to achieve and you have to do, you have to focus on being very stable, being very wise in selection of choices in life, and then choose for the welfare. From self-care to selfless care is what they have got to achieve. And healing is very different from just dispensation of medicines and doing surgery. See, that is a mechanical work, but healing takes place by the body itself. So you have to develop the holistic concept that healing is nature's responsibility, and as whatever good doctors you are, giving drugs or doing surgery, you are only helping the healing process. So what is healing has to be taught to them, and given time and the right support, healing will take place by the body. So the right understanding, love and a caring doctor is more important than a very proficient, brilliant doctor who cannot even communicate eye to eye with the patients. Because in some case when my brother was to get operated, I was able to see the cardiac, they get so busy, all kudos to their technical professionalism, but I had to wait till 1:30 to see the doctor. The patient is getting operated the next day morning, he has not even come in contact with the doctor. And my brother himself a doctor, very tense about the issue, and when I go and open my mouth, the doctor jumps at me, doesn't allow me to talk, doesn't allow me to ask a question, cannot see eye to eye with me. What is the use? And after that operation, except for one visit which that doctor did in that ICU, my brother has never had a contact with that doctor again. I chose a doctor who was more communicative, because I think health education and patient education is the most important thing to give confidence to a patient, and I knew that this particular surgeon was that time, and he spent 1.5 hours, and whenever I see, I am very happy, such a good human being who communicates. He is also an equally good cardiac surgeon, but he convinced me that I should go for surgery, and I went for surgery because of him. So you have to be good, caring doctors before you become just an expertise in it.
So suppose, madam, during one of our programs, if we conduct, if we have few students who are interested in this, so do you think it can be conducted as a workshop?
It can be conducted.
Would you like to do that?
Yeah, I would like to try that if that opportunity is given.
part of a
And I feel that
program,
GSMA has spent maximum time for trying to put this into the spirit of my staff also. But conversions are few. They say that you, not I, you have to learn to do it, so you should have continued with what we started. Had you done it, if you just heard about it, you want somebody else to come and do it. But we have to keep that mark over, because we may not, before you have to refer even to a right yogi or a right distinct. But the fact that you can go from wellness, well-being का अर्थ समझने के लिए you have to experience the well-being within ourselves. And because suddenly the Kundalini arose with inside myself when I was in a most disturbed condition, when I lost my husband and my children were 9 and 11 and all that. So that sudden rising of that, awakening of the spiritual power which jumped into my Sahasrara Chakra and I became in bliss. So the ability to do that is within you. You can go take it to Ajna Chakra by regular practice, the other is grace. So that happens.
Maybe students may not immediately appreciate
No, they will
that.
not, because
But
it takes
this
evolution.
context of just, as you said, no, wellness. As there is, so only on that aspect also do you think you can do?
Yeah, so emphasizing and teaching a little bit more on wellness. Because I remember, because I didn't know that when I was also a lecturer and all, the spiritual, one paragraph is there in part, किसी को समझ नहीं पड़े, that vague something. It's not vague something, it is very concrete experience that you can have. So if we, in the teachers of PSM, they have all got to get into wellness experience, and then they will be able to transmit it to the student as a conviction which they can experience if they do lead a value-based life. Because you don't expect a very materialistic person to suddenly experience. The Atma is within us, no? The soul is within us, and you are alive because of that. So now experience your soul. No? We can tell you anatomy and physiology of the whole thing in the body, but this is energy, that is matter, this is energy. And the energy is within you. You are not a dead person, you are a live person. So wisdom demands that you use your intellect in the right manner, the buddhi in the right thing, and get control over your mind and buddhi to go into the energy zone. That energy zone is a real thing in everyone. It is not in, there in somebody and not there in another person, right? So that type of a teaching methodology has to be done.
What I am saying now, maybe they will not be immediately this time. So just as a concept.
Yeah. Yeah, that we should be able to do. This is the science of the unknown, she said. Now, what is the science of the unknown? Then she said, you're talking too much on spiritual, you should know. Then she said, go ask Manu Kothari what he has to say about it. So I came to Manu Kothari. Then I said, what does he mean by epistemology? Then you come and attend a lecture. Then I understood she was talking about the spiritual dimension thing, but everybody is at a loss. And then she said, start a department in thanatology. For that she made this one, Dr.M.V.L. Kothari, and I was to help him. Thanatology is again death occurring in different people, how uncertain the thing of the death is. You don't have to be sick to die, and a healthy person can also die. So what is death? Thanatology. I wish I had played a greater role, but somehow or the other I didn't take up that. And I was started to ask by the ISKCON to start MS in consciousness. Consciousness is a very important aspect, but difficult to teach till I myself understood the whole aspect of consciousness. And now I am taking a session there, Sai, the super consciousness. At that time, then the dean didn't give me permission. She said, if you want to join ISKCON, you join ISKCON. But I had identified a few people. We could have made an effort at trying to talk on super consciousness in this institute. So subjects like that should be brought at a higher level, that you are capable of experiencing a higher consciousness than only the thinking mind, We have to go deeper. The same mind which we are using externally has to be projected internally and then you will get Annamaya Kosha, Anandamaya Kosha mein aane ka. Annamaya Kosha ka diseases and health we know, then Manomaya Kosha ka little bit we know, but Vijnanamaya Kosha, okay, we accept intellect is there, but we don't know the Anandamaya Kosha, we don't know the role of pranayam in breathing, and that Annamaya Kosha mein rehke Anand and bliss experience karo. If we even exhibit, subject our students to that, then they have to go into the bindu, which is the point of light that you have to penetrate to get into a total expansion of the universal state, So that is so difficult. It will come only in life after you have done certain things and you pass through life in certain way. But this is the truth. We have to teach them this concept of the body also. So that is what we need to inculcate in our studies. But after all, there's so many things that we learn as undergraduates, doesn't get used to because when the experts come into the field, so we can make our concept of the body-mind a little more clearer in the anatomy and physiology lectures. That is the only place, because all the physiologists, the All India Institute of Medical Sciences has a better this thing on this with those physiologists in there playing a better role. Therefore, doctors have to become yogis. No? Now, that is again going on to the evolution. No? How do we not get so interested in only the material aspect of it and make a hue and a cry that my earnings are not enough and my payment is not enough? What to do? Today we don't feel jealous just because my pension is at 35,000 and those lecturers who will now retire, professors who now retire will get 90,000 or 1 lakh pension. No? But isn't it? So government also will have to bring in certain things, same cadre, same pension, then people will not be frustrated. Otherwise we have got umpteen reasons to get frustrated in life. And if we want to remain frustrated, we can be frustrated. If I want to take my way out and keep my deaf ear and blind eye to what is happening, it happened because it was my prarabdha. At that time I became professor, I retired. Just because my junior professors who retire are getting much more pension, I can't sit and brood over it today. I will be unhappy myself. So I'm sure LOPA, MEHTA and myself are happy with whatever we get, that is all. We have a why is world ka region, no? But what to do? But that's why she is here today also, no? Working in her own capacity, she is allowed here. So like that, what I am doing at Dharma Kshetra is on voluntary for no paisa. I have to spend and go there. But I am trying because those people are little devotees and they are also, just because they are Sai devotees, they are not gone into this realm of, they just think Sai Baba is समय गॉड का faith करो तो तुमको उठा के लेके जाएगा. ऐसा नहीं होता है, तुमको भी effort करना पड़ता है ना. You can't merge into something with your physical body into Sai consciousness. You have to become consciousness and then you merge, otherwise you won't merge. That's it. So that is what is body-mind medicine. If this institute can start something on body-mind medicine, it can again be one of the first, because body-mind medicine is being attempted at Delhi, I think, All India Institute. So if we want to be, because this institute is known for everyone wanting to be excellent, So now the PSN people, if I can't expect, now I was talking to Kaushal Pandey when I went for my this thing. He says, do you think that I have no time for meditation? And so I said, meditate from consciousness, when will you get time? If you start, because you are already intellectual, for an intellectual person, it doesn't take much to know that there is something beyond the intellect. You have to experience it once, and then you desire it with all your mind and body, So with mind, if you desire, the body will make that thing happen. Subconscious, the body is always trying to satisfy the mind. So at mental level, you have to, so all the psychiatrists also should, mental level में तो खाली illnesses के बारे में मत जाओ. Mental health knowledge has to be improved. Mental health promotion has to be done. And then preventive mental illnesses are increasing by this thing. Therefore yesterday they were appointing 4 people at Dharma Kshetra for counselors. And they are all that Bal Vikas students, so they may make better counselors. So I said, I want a book on psychospiritual therapy, which I am trying to get, I am not getting it. But psychospiritual therapy, counseling, very important. All of us can become counselors in whichever field you are by just a little in-depth study of your mind. That has to come with it. So, nothing is lost. So body mind medicine perhaps.
सर निघाले ते बाहेर गेले ना ते परत नाही आले.
Her book on dying to be me. She went into lymphoma and her organ failure, because it spread into all over the body, organ failure had set in, and she had become emaciated with organ failure setting in, and she had a near death experience. In that near death experience, what happened was she went to the other side, okay, and then she realized that that side is so blissful, so this thing, there is something, no concept of time, beyond time, no? So this thing, and she is bringing out that very well. So she was in coma for 30 hours, she had that near death experience, and when she comes back into consciousness, all her cancer has gradually disappeared. She has no similar cancer left. And Wayne Dyer, who is also a great writer and a prolific writer, himself had lymphoma, and they are publishing those things very loudly. So what is this near-death experience? I have had that near-death experience when my daughter was being born. When the baby was taken out, everybody's blood pressure comes down because sudden vacuum creates Rodana. At that time, I had gone into a stage out of the body, and I was observing my own body, and I repeated everybody's conversation of the gynecologist with the doctor and all that, and the hurry-burry in the theatre and all that, and they said that no, anesthesia must have been poor. I said no, I was not having any pain, but I was somewhere out. Nobody understood it as near-death experience. And Gopa Kothari, are you near to Gopa Kothari's classmate? No, no, you are in this institute, but Devyani was my anesthetist. She also profusely apologized. I said, because we never understand what is this, the out of death, the out of body experience. And I was there watching through a thing, and then I resuscitate Kia. I came back into the body, you know, but it's very vivid. Then when I was developing spiritually, I went out of the body to resuscitate my uncle in Mysore who had had a collapse, and I did something to resuscitate him, and I'm back in my body. So out of, again out of body experience. All these are possible, not that you can will it by your thing and it happens, but if it happens, you have to have an explanation. We all get branded into psychiatric thing. If I say I heard this or I saw this, nobody will understand. So my guru told me, don't go and tell your people that this, otherwise they'll put you into a psychiatric thing and give you strong psychiatric drugs. But when you are sane, you don't behave like that. There are people who are schizophrenic who behave. But if we want to see that we decrease the incidence of mental diseases, we have to catch them early. No, otherwise then it is difficult to rectify afterwards how much is there imagining. Therefore I say, when you are appointing counselors, I hope that, because I don't want mental illness people coming into my wellness clinic, and they're all sada females, devotees, no? What will they treat, what will they counsel? And they'll become hazardous because they'll become violent. So that is a group for illness. But otherwise psycho-spiritual counseling नहीं मालूम है तो वो लोग counselor बन के कुछ उपयोग कर रहे हैं. So therefore, before illness goes to the maximum, I can't expect cancer and everybody getting rectified through healing through this way. It will have to be prevention in its approach, but also hope and faith. My cancer is me. Another workshop I attended, and in that the husband had the cancer, and then wife went to this Pondicherry to the mother's cellular healing she has learned, and the husband went to China and learnt many of these acupressure and other things, and today he is free of cancer totally, and they are trying to spread cancer information message. I was trying to get contact with Shastri to include them in their efforts, but who listens to you? Nobody listens. Our medical, this thing is blind. I was trying to tell the Medical Association, IMA, whose continued medical education program I was attending, that give me one chance and you just hear me talk on one session for healing ke liye, how this science helps. They are not giving me one chance in the IMA Association.
People are scared.
They don't want me to take. So now I have stopped going there because anyway my conditions are preventing. अरे कितना illness के बाद में मैं अभी सीख के कहाँ करने वाली हूँ. अरे थोड़ा insight तो ले लो जो कुछ है. And we are not mad people, no? At least they should be having some that we have also stood something we are in the medical college. तो भाई है तो बोलने का सुनना चाहिए ना, कोई सुनने को तैयार नहीं होता है. That is the sadness about the thing.
I think this mental wellness. Just
Mental
students, mental wellness. Students need with this too much of MCQ, too much of information. The balance is toppled.
And wellness can really be understood when you get into some amount of soul consciousness. At least acceptance of that will make you read that literature and accept, हाँ बाबा मेरे को समझता नहीं है, but there is a field like that. Because then they should want it. So your inner aspiration opens the door for you, you know. When you say knock and it shall open, where shall I knock to open, you know. So you have it in your mind and believe. Don't say I don't believe. Once you shut your door, your mind into not believing, then it will not happen to you. Grace can come to you provided you are willing and open to the grace, na. And once grace comes,
Ready to receive it.
ready to receive it. नहीं तो फेंके क्या कहते हैं, पर कैसे वो shower होगा? If you put an umbrella and twist it in a tight corner and say that I don't want to receive it, it will not come. That is why the Lord has given us free choices in choosing what we want. You know, very compulsory. But if we are intellectuals, we should be open in all this. Not superstition and become thing like that. But we have to. Shall
फोटो काढूया.
they are very fond of. Jyoti meditation is a superficial meditation that they have put as a in the agenda. Now those people will understand the value of namasmaran or bhajan singing because they are all into it. But otherwise they want namasmaran नाही म्हणायचं, हे नाही म्हणायचं, असंच होणार ना आपल्यामध्ये. But for a certain section of people, it is that नामस्मरण और जपा करने में उसको बहुत फायदा होता है. But that is the beginning stage. You have to go into deeper stages. I tell them Jyoti meditation is superficial. You are taking your Jyoti and trying to say that my eyes will become pure, my ears will become pure. Again, purity of the body is a necessity, but purity of mind also is very important, and purity of intellect is
More important.
So fear, what is the purity of mind? What shall I wash or what shall I clean or what shall I this thing with it, you know. So it is in your thinking process. So it is in your hands. तो वो जो है वो कॉन्सेप्ट कैसे दिलाने का, unless you are willing to listen and willing to, वो willing ही नहीं होते हैं, जैसे ही बंद हो जाता है. Where? Because the medical associations are not opening it up. A plus grade.
A plus.
मेरा plastic bag में से